They gave the new nurse the silent veteran because they wanted to watch her fail. Eloise Harford had been at Sunridge Veterans Care Center for 22 days. 22 days of being handed the difficult rooms, the patients nobody wanted, the charts that landed on the desk with a thump and a pitying smile. She was quiet. She moved without fuss. She wore her bright blue scrubs slightly loose at the sleeves, kept her dark auburn hair pulled back in a knot that was always threatening to come undone. And she let people underestimate her because, in her experience, invisibility was a better armor than pride. That changed on a Tuesday morning in November, when Beverly Schramm tapped a pen on the nursing station desk and said the 7 words that were supposed to end Eloise's shift in humiliation. "Parker, Ward 7, Bed 3, he's all yours." Eloise wasn't Parker. She had corrected Beverly twice in 3 weeks and stopped bothering. She picked up the chart. Master Corporal Devon Parr, retired, 44 years old. Former Canadian Armed Forces, Special Operations Element, admitted after a collapse during a routine veterans clinic appointment, suspected cardiac irregularity, unexplained blood pressure drop, fever of 38.9. Repeat note printed 3 times in red at the top of the chart, nonverbal, non-compliant, do not enter without escort. Dr. Roland Hatch leaned against the doorframe of the physician workroom with his coffee and his certainty. He was the kind of man who wore his competence like a pressed shirt, visible, deliberate, and slightly stiff. He looked at Eloise the way people looked at furniture they weren't sure they'd ordered. "Parker," he said. She didn't correct him. "Parr in Bed 3 won't let anyone examine him. He's been here 11 hours. He overturned a breakfast tray, threw a tablet across the room, and growled at the orderly." Hatch paused to let that word growled. "Do some work. See if you can get vitals. Nothing invasive. Don't escalate." Jonah Crest, the second-year resident, was already half smiling. His phone was in his right hand at an angle that was too careful to be casual. Pam Doucette, an LPN who had been at Sunridge for 9 years and who organized the staff birthday pool with cheerful efficiency, stood near the medication cart with her coffee. She caught Eloise's eye and gave a small apologetic shrug that wasn't quite apology enough. Eloise looked at the chart again. Non-verbal, not the same thing as non-communicative. She had learned that distinction a long time ago, in a place with no electricity and a ceiling that was slowly coming down. She walked to Ward 7 alone. "Welcome to Steady Badge's Stories. I'm glad you're here. If you're someone who has ever been handed the hardest job in the room because nobody expected you to do it well, this one's for you. Hit the like button if the story stays with you, subscribe so you don't miss the next one, and drop a comment telling me where in Canada you're listening from. I want to know how far these stories travel. Now let me tell you what happened in Bed 3. The door to Ward 7 was solid wood with a narrow window. Eloise stopped outside it and looked through. Devon Parr sat with his back against the headboard rather than the pillow. Not for comfort, for sight lines. She recognized the posture before she registered his face. The specific stillness of someone who had trained himself to see every exit in a room before deciding whether to stay in it. He was a large man, broad through the shoulders, with close-cropped gray at his temples, and a jaw that looked like it had taken a hit or two and hadn't much minded. A bandage wrapped his left forearm. His eyes were moving, door to window to the sharps container near the sink, to the call button he clearly had no intention of pressing. A whiteboard hung on the wall. Someone had written, "Patient is mute. Use communication only." The marker was on the floor. Eloise knocked twice on the doorframe with her knuckle. Not loud, not soft, just deliberate. Devon's eyes stopped moving and landed on her hands. Good. He was watching the right thing. She pushed the door open slowly, palms visible, body angled so she wasn't blocking his exit. She picked up the whiteboard marker from the floor without making a production of it and wrote, "My name is Eloise, I'm your nurse. I won't touch you without asking first." Devon Parr read it. His expression didn't change. Then he reached across the bed and picked up the notepad on the side table. He wrote something and held it up. "Where's the other one?" "I sent them away," Eloise said. His eyes narrowed. He wrote again. "They sent the new one because they think I'll scare you off." "Are you planning to?" He studied her for a moment, then wrote. "Then we're fine," she said. "Can I check your vitals?" He held up one finger, his other hand moved. It wasn't a gesture, it wasn't frustration. It was 3 distinct movements. Thumb to forefinger, 2 fingers extended flat, then a close, and Eloise's blood dropped about 3 degrees in temperature. That was a CAF tactical signal, not civilian sign language, not improvised operational hand code, the kind developed for units working without radios in compromised environments. It meant, wait, confirm you're clear, threat nearby? No civilian nurse should have understood it. Eloise kept her face very still. She answered him. 2 fingers crossed at the second knuckle, then a slow open palm. "Clear, no threat, I see you." Devon Parr did not move for a full 3 seconds. Then he sat straighter, Not with tension, but with something that looked, almost like relief. His hands moved again, slower this time, deliberate. Identify. Eloise should have looked confused. Confusion would have been safe. Confusion would have let her walk out of that room with her history intact and her secrets in the same drawer she'd been keeping them for 6 years. Instead, she looked at the monitor on the wall. His pulse was 118. His oxygen was reading 93. His color was wrong. Not dramatically, not in the way that rang alarms, but in the specific yellowish gray that she had seen before on men who were bleeding somewhere a monitor couldn't see. She answered him in the same code, one bent finger, one straight, standing by, not here to harm. Devon exhaled once through his nose. Then he looked at her right forearm, where the sleeve of her scrub jacket had ridden up half an inch. There was a thin burn scar there, pale and old, running diagonally from her wrist toward her elbow. Clean lines, the kind left by a very specific kind of heat. His eyes came back to hers, his lips didn't move, but his hands did. Echo? Eloise stepped back from the bed. One step. She picked up her clipboard and wrote on the whiteboard without looking at him. May I take your blood pressure? He let her. She wrapped the cuff around his right arm with careful hands. No surprise pressure, no clinical efficiency that forgot there was a person underneath the readings. Blood pressure, 104/68, pulse, 118, temperature, 38.9. Oxygen, 92 now and dropping. She listened to his lungs. Left side clear, right side reduced, not absent, but reduced. And he was guarding something in his right lower quadrant, his hand resting there with a stillness that wasn't rest. Pain there, she wrote. He nodded, dull since yesterday, worse since this morning. Fall? No clinic appointment, blood draw, then it started. Eloise stepped back and looked at his chart again. No imaging beyond a chest x-ray on admission 12 hours ago, no abdominal ultrasound, no follow-up blood work ordered. Dr. Hatch's notes said, patient uncooperative, vitals within normal limits at time of assessment, anxiety response, monitor and reassess. She wrote on the whiteboard, I'm going to ask for a repeat assessment. Your numbers have changed. He signed back in the old code, 2 movements, Hatch won't listen. She signed back, that's not your problem to solve. He almost smiled. It was a very small thing, barely visible, but it was there. Eloise found Dr. Hatch in the physician lounge. He looked up from his tablet with the particular irritation of a man who had organized his morning around the expectation of not being interrupted. She gave him the vitals. She gave him her clinical assessment. She was precise and calm and used no filler words. Hatch listened with the expression of a man listening to a radio station he hadn't chosen. He's anxious, he said. Veterans present with somatic symptoms. The vitals are borderline. The trend is moving in the wrong direction. I'll reassess this afternoon. He needs imaging now. Hatch closed his tablet with a soft final click. Nurse Harford, you have been here 3 weeks. I have been here 14 years. Do your job and let me do mine. Eloise met his eyes. She had learned in rooms much louder than this one that a quiet voice carried further than a loud one. Of course, Dr. Hatch, she said. I'll document this conversation in the chart. Something shifted in his expression, not much, but enough. She returned to Devon. By 11:30, Devon's oxygen had dropped to 90. His pulse was at 128. He was no longer guarding his right side in a casual way. His hand was pressed firmly into it, and his jaw was tight with the specific quality of someone managing significant pain without complaint. Because complaint had never been what kept them alive. Eloise rewrote the vitals on the whiteboard as she took them. Devon's eyes tracked every number. His hands moved in the old code. Hatch is going to say it's still anxiety. He might. His next signs were slow and careful, each one deliberate, internal, right side, it's moving. She had heard that combination before, in a different context, a different room, but the same urgency underneath it. She put her stethoscope to his abdomen. Bowel sounds reduced. She pressed 2 fingers gently below his right rib cage. He inhaled sharply. Rebound tenderness. This was not anxiety. She pressed the rapid response call button herself. Hatch arrived before the team, which meant he'd been close enough to hear the announcement, and had come to stop it rather than answer it. Jonah was 2 steps behind him. Pam appeared at the doorway and stayed there. What did you do? Hatch said. Called rapid response. His status changed. His numbers are borderline at worst. His numbers have been trending for 4 hours. His BP dropped to 100 systolic. He has right-sided abdominal tenderness with guarding and reduced bowel sounds. He needs ultrasound and a surgical consult now. Hatch looked past her at Devon. Devon looked back at him with the steady, unhurried gaze of a man who has been underestimated so many times that it has become its own kind of patience. This is PTSD presenting somatically, Hatch said. Then the ultrasound will confirm it and we'll all move on. But if it isn't... I am the attending physician, you are the bedside nurse. I am telling you this is anxiety, and I am telling you to stand down. Eloise looked at Devon. In the old code, barely visible, his right hand moved against the blanket. Don't stop. She turned back to Hatch. I won't stand down from a patient who is deteriorating. The rapid response team arrived. Dr. Anita Serene from the trauma unit, 2 nurses, a respiratory tech. Serene was in her 40s with the efficient quietness of someone who had stopped wasting words somewhere around her 2nd year of residency. She looked at Devon, looked at the vitals on the whiteboard, and looked at Eloise. Tell me. Eloise told her, vitals, trend, timeline, physical findings. She spoke for 45 seconds and used no unnecessary words. Serene called for point-of-care ultrasound. Hatch objected. Serene did not look at him when she said, Arthur, if I want your opinion, I'll ask for it in the form of a written request. The ultrasound image loaded. Serene leaned in, her face changed. Free fluid, right upper quadrant, significant. She straightened. He's bleeding, he needs the ore now. Hatch stared at the screen. The silence in the room was the particular kind that falls after a man's certainty has been publicly and undeniably stripped away. Devon's blood pressure dropped to 92 systolic. His eyes found Eloise's. His hands barely moving against the mattress. Stay. I'm here, she said. She said it out loud, which she hadn't intended to do, and the team heard it, and nobody said anything. Surgical is on their way, Serene told Eloise. You briefed me correctly. Good catch. 2 words. Good catch. They landed somewhere unexpected. Eloise looked at the floor for 1 second. There had been a room once, much darker than this one, where a man had been bleeding in the wrong direction, and she had been 26 seconds too slow to reach him. She had carried those 26 seconds in her right forearm scar ever since. She pushed the memory down. Devon needed present time, not ghosts. Devon Parr went into surgery at 11:52 a.m. The team found a slow splenic laceration, likely exacerbated by the anticoagulants he'd been on for a separate cardiac condition nobody had cross-referenced. Either way, if the bleeding had continued another 2 hours undetected, the outcome would have been different. While Devon was in surgery, the hospital began to talk. 3 versions of the story were already circulating by the time Eloise reached the break room. In one, she had overruled a senior physician without grounds. In another, she had some kind of military background nobody could verify. In a third, Devon had only cooperated with her because of some kind of signal thing, said with the tone people used when they meant, something I don't understand and therefore suspect. Eloise poured herself coffee and said nothing. Pam Doucette found her at the sink. He made it through the first part, Pam said. They're saying 2 to 3 hours for the rest. Good. Pam was quiet for a moment. She was an honest woman underneath the coffee pools and birthday lists, and honesty sometimes took a minute to surface. I should have said something, she said. When Beverly said to give you Ward 7 as a joke, I should have said something. Eloise looked at her coffee cup. Why didn't you? Pam winced. Because I thought it would be harmless. Because he'd already scared off 3 other people. Because she stopped. Because it was easier. Harmless to who? Pam didn't answer. That was an honest non-answer. Figure that out, Eloise said. And then teach it to someone who hasn't figured it out yet. Gerald Oates, the hospital administrator, called the meeting at 3 o'clock. The conference room was on the 4th floor, away from alarms and blood and the smell of floor wax and effort. Framed mission statements hung on the wall. Compassion, integrity, excellence. The frames were the straightest things in the room. Eloise stood. She preferred to stand. Across from Hatch and Jonah and Oates and a woman from risk management. Beverly sat in the corner with her arms crossed. Mrs. Harford, Oates said, we're reviewing this morning's incident. I'd call it this morning's catch, Eloise said. Hatch's jaw tightened. You called a rapid response over my explicit instruction. Mr. Parr's BP had dropped 15 points and he had physical findings consistent with internal hemorrhage. Calling rapid response in that clinical picture is correct nursing practice. You are not a diagnostician. I reported clinical findings to a physician who ignored them. Then I used the systems available to me to protect a patient. That is exactly my role. Oates opened a folder. There's an additional concern. Staff have described some kind of communication happening between you and Mr. Parr. Nonverbal, unfamiliar. Eloise said nothing. What were you communicating? Hatch said. I was building rapport with a nonverbal patient. That's also my role. You seem to understand signals that nobody else did. People who are nonverbal communicate in many ways. Good nurses pay attention. Hatch leaned forward. Who taught you military hand signals, Ms. Harford? The room dropped 2 degrees. Eloise kept her voice very even. I don't know what you're referring to. Beverly spoke from the corner. Staff said it looked like code. Staff, Eloise said, were supposed to be at their stations. Jonah shifted in his chair. Oates cleared his throat. You should understand that your position here is probationary. The door opened. Dr. Serene walked in with Devon's updated surgical report and the particular energy of someone who had decided, about 30 seconds ago, that a meeting was worth interrupting. I heard there was a review, she said pleasantly. Oates forced a smile. This is a personnel matter. It's a patient safety matter. I'd like to contribute. She set the report on the table. Mr. Parr had a grade 2 splenic laceration, with approximately 400 milliliters of free abdominal fluid. Conservative estimates suggest he would have reached hemodynamic instability within 90 minutes of the point. Ms. Harford called rapid response. The intervention was clinically indicated. Hatch stared at the wall. Serene looked at Eloise. You documented the vitals trend? Yes, from 9:40 am onward. And you documented Dr. Hatch's response to your concerns? Yes. Serene's eyes moved to Hatch in a way that was not aggressive and did not need to be. Arthur, she said, when's the last time you reviewed the early warning score protocol? Nobody breathed. The risk management woman was typing very quickly. And then the door opened again. Devon Parr was in the doorway in a hospital gown, IV pole in one hand, post-surgical drain visible at his right side, and the specific expression of a man who has decided that lying in a bed while someone else is held accountable for saving his life is not something he is willing to do. A surgical nurse hovered behind him, horrified. Devon found Eloise in the room. He pointed at her. Then his hand moved, not the old code this time, but something direct enough to cross any language barrier. He pointed at Oates, then at Hatch, then at himself, then at Eloise. Then he drew a straight line in the air between himself and her. Eloise translated without being asked. He's saying she is the reason he is alive. Devon nodded once sharply. Then he signed something in operational code. She hesitated. He signed it again. She said, He asks me to tell you that nonverbal doesn't mean absent, that no one in this hospital spoke to him as a person until she did, that he was in pain for hours and every record shows that he communicated it, in every way available to him, and was ignored. Beverly had her hand over her mouth. Jonah was looking at the table. Hatch was looking at Devon with the expression of a man who can feel the ground shifting, but hasn't yet decided how to respond to it. Devon then spoke. His voice was rough from disuse, from however many years it had spent gathering dust while he found other ways to be heard. It came out low and careful, each word placed the way you placed a foot on uncertain ground. She listened, he said. The room had no answer for that. Devon's knees buckled, the effort and the blood loss and the surgery catching up all at once. Eloise was across the room before anyone else processed what was happening. She caught his arm. Pam, who had appeared in the doorway, brought a chair without being asked. Serene moved to check the drain. Eloise held his arm and said quietly, That was enough, you don't have to say anything else. His hand found her right forearm, where the scar was. He didn't say anything, he didn't have to. Serene had him back in a wheelchair in under a minute. As they rolled him out, he turned and looked at Oates. Even without words, the message was clear. Oates looked at Eloise. This review, he said carefully, is not concluded. Serene looked at him from the doorway. Schedule it when your key witness isn't attached to a drain. Devon was back in his room by 4 o'clock. Eloise sat in the chair beside his bed and wrote her notes in the careful handwriting she used for everything that cost her something. He was watching her. When the room was quiet and the last nurse had checked the drain and gone, he picked up the notepad. I searched for you, after Weyburn. Eloise stopped writing. Weyburn was the name of the operation that didn't officially exist on any record she had ever been permitted to see. She had been out of uniform for 6 years, and the sound of that name felt like pressing on a bruise she had taught herself to forget was there. Don't, she wrote on the whiteboard. He wrote back. They said Echo went down going back for Bassie. Many people didn't make it. Bassie made it, because of you. She turned to look at the window. The sky outside was the flat gray of a Canadian November, the kind that settled in around Remembrance Day and forgot to leave until April. He wrote, You went back without a tether. She kept her eyes on the window. There was a very specific weight to being known by someone who was there. Most of the weight was good, some of it was not. She wrote, Bassie lost 2 fingers. He wrote back immediately. He didn't lose his life, that was yours to keep. The grief that lived in her right arm scar moved the way old injuries did when the pressure changed. She pressed her sleeve down over it. She wrote, Why did you come to Sunridge? He was quiet for a moment. Then, I brought something. Evidence, medical supply contracts, falsified equipment certifications for the op, the gear that failed. I've had it for 2 years and I don't know who to trust. Eloise looked at him. Where is it now? He pointed to his kit bag on the bedside chair inside, in the lining, a drive. She looked at the bag, then at the door, then back at Devon. Does anyone else know it's here? His expression answered before his pen did. Someone does. That's why I collapsed at the clinic. The blood draw, wrong vial, wrong nurse. She was gone before I could write anything down. Eloise set down her pen. Outside the room, the hallway was quiet. Visiting hours were over. She could see through the narrow window. Pam at the nursing station. A porter near the elevator. A maintenance worker by the supply room whose shoes were the wrong kind. Too clean, too soft, for someone who had spent the day mopping floors. She picked up the phone and called the station. Pam, I need you to check the pharmacy access log for the last 2 hours and get security to walk the service corridor near supply. Pam's voice was careful. Ellie, what's happening? Probably nothing. She kept her voice level, but do it now. Devon had watched her expression change. He wrote, threat? She kept her voice level. Stay in bed. Don't touch the bag. He wrote back, not my first threat. She moved the kit bag behind the IV stand, out of sight from the door window, and she stayed in the room. The next 40 minutes were quiet in the way that quiet could be 2 things at once. Then the fire alarm pulled, not a drill, but the specific short sequence that Sunridge used for an unverified threat, which most visitors wouldn't know the difference of, but which Eloise knew. She killed the light in Devon's room. She moved the chair against the door at an angle. She handed Devon the call cord. He held it like the weapon it was. Security arrived in 4 minutes. They found the maintenance worker in the south stairwell with Devon's kit bag. The one he'd had under his bed, which the man had reached before getting to the supply room. The drive was still inside the lining, intact. The man's hospital ID scanned correctly, but belonged to someone who had left Sunridge's employment 8 months earlier. Pam had locked the pharmacy. She had also called the RCMP, because Pam had done 12 years in this building, and she had learned to trust what she heard in a person's voice when they meant it. 2 federal investigators arrived at 6:15. A man in a CAF uniform was with them. Eloise recognized the rank before she recognized the face. Captain Brix Hollowell stopped in the doorway of Devon's room and looked at Eloise Harford in her bright blue scrubs and her fraying hair knot and the pen still in her hand. He said one word. Echo. The hallway behind him held its breath. Devon from the bed signed 2 things. First in operational code, confirmed. Then out loud, his rough voice carrying past Hollowell to the staff gathered quietly in the corridor. She came back, every time. The formal review happened the following week. By then, the drive had been authenticated, the contracts it contained, falsified equipment certifications, vendor payments, 6 signatures on gear that had failed in the field and been recorded as operator error, had generated federal warrants. Hatch's name appeared on 2 approvals, not for money, for silence. He had buried a complaint Devon had filed 3 years earlier, flagged in the system as unreliable source, patient history of PTSD. Gerald Oates, to his credit, looked genuinely stricken when he read the file. Beverly Schramm did not come to work the following Monday. Jonah Crest submitted a written apology. It was 1 page, and it was clear that someone had stayed up to write it. Eloise read it twice and kept it, not because it resolved anything, but because effort mattered when it arrived. Pam Doucette was given a commendation by the nursing director, which she accepted with the pragmatic embarrassment of someone who knew she was also accepting recognition for a night of atonement. She started an ASL elective for the nursing staff the following month. She was the worst student in it, by her own admission, and she attended every single session. Devon was discharged on a Thursday, 17 days after admission. He stopped at the nursing station on his way out, the same station where the joke about bed 3 had started, and he wrote on the whiteboard in letters large enough for the corridor to read. She was never too soft. You were never paying attention. Eloise read it. She didn't look away. Captain Hollowell had offered her extraction, a new city, a resealed record, a fresh start with her history safely buried again. She had declined. She had given her answer standing in Devon's doorway with the pen in her hand. She was answering as a nurse. What she wanted, she told Oates in the formal review, was not an apology. She wanted written protocol. Every nonverbal patient assessed for communication needs within 4 hours of admission. No chart-coded non-compliant before staff documented what had actually been tried. No patient labeled uncooperative without a clinical note explaining what communication was attempted. No room entered by students or residents for any purpose that wasn't care. Oates approved all of it, written, signed, posted on every unit by the following Friday. Devon, signing with Eloise at the door before he left, said, "You could have stayed hidden." She answered in the old code, "You needed a nurse." He looked at her for a moment with the specific expression of someone choosing not to say the thing that would make the moment into something it wasn't ready to be yet. He wrote instead on a small piece of paper from his jacket pocket. Halifax, March. Coffee if you want. She folded it and put it in her scrub jacket pocket. Then she clipped her hospital badge straight, Eloise Harford, RN, Sunridge Veterans Care Center, and went back to work. People told the story wrong for months afterward. They said the quiet nurse turned out to be dangerous. They said the mute veteran had been carrying federal evidence in a hospital bag. They said some kind of special operations past had walked through Sunridge's front door, and nobody had known it was there. All of that was true, but it wasn't the heart of it. The heart was smaller and more ordinary and more important than any of that. A group of colleagues decided that a patient's silence and a nurse's quietness were both tools for humiliation. They expected laughter. What they found instead was the truth about what those silences contained. That was what Sunridge Veterans Care Center didn't forget. Never mistake stillness for weakness. Never mistake quiet for empty. Never assume that the person nobody is listening to has nothing left to say. Because sometimes the one everyone assigned as a joke is the only one paying close enough attention to hear what the room is trying to tell you. And sometimes that is exactly enough.